shortage across the country? Does anybody know?
Yeah, so there's a couple of reasons for that. Some of our physicians in our community that practice a long time, they work long hours. Some of the new physicians, work-life balance is a huge piece. So what we're seeing is sometimes it takes 2 physicians to replace a physician that's been practicing for 30 years in our community. That's one of the pieces. Some of you, if you're following what's happening at the medical school down in Boise, the challenge in our country is having residency programs. So it's one thing to go to medical school. It's another thing to get into a residency to figure out what that specialty looks like. And that's the challenge, because we don't have enough residencies. So there are students that have actually completed medical school but can't get into the residency programs in there. So that's one of the other challenges. And then again, just the number of patients that are coming into our healthcare system. We don't have enough physicians for that. You're welcome. So the other thing facing small hospitals like Gritman and most of the state of Idaho, most of the hospitals in Idaho are critical access, is hospital closures. So since 2010, there's been 90 closures in our country, and they're estimating that it will continue to happen. About 1 a month is what they're predicting. And the challenges for those towns and communities, just like Gritman, is we are the largest private employer. We're an economic engine for our community. And so what you're seeing in those smaller communities is job losses in there. It's a hit to the economy for those communities, unfortunately. And so that's a huge concern out there. I mentioned our operating margin changing in 2018. One of the things that we ended up using, and I have 2 former nurses here and did nursing education, is, and Nancy, you're a nurse too. So one of the things that I saw back in probably 2002 to 2008 is nursing shortage. We didn't hear about that for a long time, but we're now starting to see that. It's challenging to find nurses, especially nurses with a lot of experience, especially in your ICU area or in your surgery departments. So that's causing a huge piece. So what we ended up having to do is pay for what are called travelers. And you're usually paying 2 to 3 times higher than your normal labor costs in there. So that's going to continue to be a challenge in our industry. So let's talk about services at Gritman. So some of these, how we get there and how we look at what services we're going to offer is essentially developing a strategic plan. So some of you in the room might have helped us with that. So what we do is we work with our board of directors and our community board and community leaders to find out what services we need to do. Where's the direction of healthcare going? What do we need to provide? Because our goal is to keep people in our community. I know how challenging it is to get healthcare, especially if you have to travel. And so we want to try to bring those services in here. So we have essentially 7 pillars that we look at in there, and then we have strategies related to those. The other thing that we do is a community health needs assessment. So this is because of our structure under the IRS. We had to start providing a community health needs assessment. In my opinion, it's a duplication of what our strategic plan does. But here are some of the initiatives that came across in that last one about addressing mental health and suicide, substance abuse, physicians, and that's really having those physicians here, affordability and access, and obesity and overweight. And so from a Gritman perspective, you can go out and read this report if you have an interest. It's on our website. Our strategy is, and the IRS's strategy is, we as Gritman don't have to solve it. We can partner in there, and I'll talk about our partnerships to address some of these. So some of our strategies as we look at both of those is our partnerships, and I'll talk a lot about those. Physician recruitment, we do have a lot of strategies around physician recruitment. A program called the 340B, I will say that is new access for hospitals to obtain additional revenue. It's actually paid by the pharmaceutical companies, and so it's been a great new investment and initiative for small critical access hospitals. J1 visa legislation change, that's one thing I worked with some of our representatives here on changing how we can recruit J1 visas. So in our state, just to give a little history, in our state, Every year, we were allotted 30 J1 visas. The way our statute was written, you could use those J1 visas for primary care, psychology or psychiatry, pediatricians, general surgeons, but that's it. So our state, overall state, only did one J1 visa every year. Washington, their legislation was a little different. It was a little broader in there. And those J1 visas come available October in Washington. They are gone by usually January or February. And so I worked with Iowa Hospital Association because one of the initiatives we're trying to do is recruit oncologists. Our J1 visa in the state did not allow that. And so we got the statute changed. We actually made it broad enough so some of the larger hospitals can help recruit. And I'll tell you that we actually recruited 2 J1 visas. They're very well-trained physicians. Yes.
So tell me the meaning of J1 visa. What does that mean?
So they did their medical school in a foreign country, but they did their residencies here in the States. Expansion of outpatient services, we'll talk a little bit about, and our practice partnerships. So as I mentioned, we define customers, essentially we have 4 that we look at. Patients, obviously, that's why we're here as an organization. And there are physicians, our customers. For the most part, we didn't employ a lot of physicians. When I first stepped into this role, we employed very few physicians. We partnered with them to bring services in. And we needed them, and they needed us, but we didn't employ a lot. We're employing more now. Our people, our employees, obviously that is one of our customers, and in the community. We want to make sure that we're serving our community and keeping healthcare here. So when we talk about patient focus, again, our goal is to keep people in our community and being able to reserve services in there. And so big part is recruiting providers, focusing on our customer service, and then bringing those services in. So some of you might have seen our new advertisement. It's on your flyer. We are now a 5-star hospital. So Medicare came up with initiatives, and part of the Affordable Care Act was looking at quality. And the way Medicare looks at quality is 2 ways. One, there's certain measures on quality, and then they also look at patient satisfaction. What they want the hospitals to do is, it's one thing to have a patient come in, it's another thing for patients to be satisfied with their care. And they really look at, and this, some of you, if you've been a patient, might have got a call regarding this. They have these different areas that they're asking our patients about, and they only count those that when you answer a 9 or a 10. If you answer an 8, they don't even count it. And so our goal was to be a 5-star hospital, and we're competing with all the other hospitals. So as we introduce strategies, we're competing with the other hospitals because everybody's trying to get better. But these are our scores in these different categories. So they ask questions about our nursing and the communication, and usually those questions have always in it that you're always communicated about medication. Same with the physicians, the responsiveness of our staff. And so if you think about, you fill out surveys, because I know how I fill out surveys, to get a 9 or a 10, you have to really knock my socks off. And so that's what they're trying to get at, is how well our hospital is doing that in there. So some of our normal services, and I won't go through this, hopefully you are all aware, but from a hospital side, yes?
I was wondering, who is it that determines who collects the information and says you're 5-star?
So what happens on these is Medicare, so CMS, actually came up with the questions. They are standardized throughout the industry. And there's 2 ways you can do those from a hospital. So you can mail out, you have to contract with these different entities that actually administer those. So there's 2 ways you can do it. You can do a paper survey, or you can do a phone survey. If you do a phone survey, they actually knock out some points on that. And the reason for that is if I call you and say, how well was the nursing staff, and ask you the questions, you're probably going to be nicer to me because it's a phone call versus a survey. So they actually knock that down, but that's a great question on who's doing that. Yeah.
So is that just some statistically significant number of people who were then interviewed or asked to fill out questionnaires? So because I know we used to always get contact with any touch we've had with the hospital, and that's not existing.
Right, so they look at, so we provide the company that we work with, and our company now is Press Gaming. It was bought out, they bought out HealthStreams, who was our former company. And so we actually send all of that information, it's all HIPAA approved and all of that, privacy piece, and they actually select the patients. We don't select the patients, so it's random on our side, but they need to make sure it's statistically valid in there. And so they're the ones that actually do all of that piece. So some of these services, hopefully you know of all of those, or hopefully not, if you don't come to the service. From a clinic standpoint, this is one place where we really grown. When I first started as CEO, we had our Potlatch, Troy, and Kendrick clinic. Those clinics have been long-standing clinics. Potlatch was our first, it actually started in 1994. And then we took over Kendrick in 99, and then took over the Troy clinic back in about 2011. But then we've added clinics. So we added internal medicine, so it's across the street from the hospital. We have 2 internal medicine physicians in there, and that was because there was a gap in that coverage. And when Police Medical left our community, we didn't have as many. We have Dr. Spady, who's internal medicine, but needed to cover that gap, and so we were able to hire 2. Our interventional pain management, that's new, and so that's not opioids, that's actually injections in there, so for back pain or knee pain, or hip pain, that's what that clinic is structured around. Psychiatry, if you go back to that community health needs assessment, that was one of our initiatives. So I was able to recruit essentially 2 psychiatrists to our community. One's full-time and one's comes up every month. And then Moscow Family Medicine, I'll talk a little bit about that along with their clinics. And our new one that we're starting is pulmonology. So we've recruited a pulmonologist, and he will be actually doing an outpatient pulmonology clinic. So as I mentioned earlier, the shortage that you can kind of see on this map as far as our shortage in here. And Idaho obviously has a lot of shortages. Other areas don't have as much, but that is our challenge in our healthcare industry. As we talk about partnerships, there's a lot of partnerships we have. And I don't have them all listed, but just kind of highlighted some of the big ones. One of that you may know about is dialysis. So that's actually a partnership between us and Fresenius. We started that back about 10, 12 years ago. And at that time, there was about 12 or 14 patients in our area, in our service area. That is actually doubled now. And if you know anything about dialysis, dialysis is life-changing. Usually you have to go 3 days a week to get dialysis. And so we had patients coming in clear down as far as an hour from home to do dialysis. It usually takes 4 to 6 hours. So that was a huge need, and we were able to find a great partner in Fresenius to do that. Our late community health clinic, Chaz, actually came in several years ago. Nancy was instrumental in helping get Chaz here, and that clinic is actually expanded. So they're in our medical office building. They doubled in size when they went in there. They're offering dental, so that was a need in our community. It was on my community assessment report several years ago, and with their expansion, we were able to take that off, so that's been great. Providence has a telestroke program with us, and so they have equipment where if you come in and you're having a stroke, essentially they can dial up and those neurologists can talk to the patient, they can get the vitals, they can see what's happening, and help the emergency department physician provide care. If that patient stays at Gritman, we can actually take that equipment up to the ICU if need be, and dial in and have that service up in our ICU unit. So it's been a great partnership.